Hello, and welcome to this edition of Why Truth Matters. Today we're going to discuss one of my favorite topics, the medical loss ratio. The medical loss ratio mandated that 80 cents out of every dollar the insurance company collects gets paid to a third party in claims, i.e. the doctor, the hospital, the pharmacy. That leaves them 20 cents to operate their entire business. Building, phones, lights, staff, internet, agents, policy development, anything you can think of that an insurance company would do. Now, when we take a look at this, what we're going to realize is that the federal government really has no idea how businesses operate or what you would do to try to control medical expenses. This will just be another example of how Obamacare is going to eliminate every affordable option in health insurance. Now, how can I say that when the president says that the medical loss ratio will reduce insurance companies' evil profits and help bring the cost of medical insurance down? The first thing we need to know is that insurance companies only operate at about 2.3% profit. That is a very small profit margin for any business. Almost no business owner you know would try to operate at 2.3% profit. They may make a couple of $1 million in profit, but it's because they're dealing with hundreds of millions in premium and hundreds of millions in liability. As far as the medical loss ratio is concerned, let's break this down and understand how it would really work. Let's say that you're the insurance company and I'm a doctor or a hospital or the pharmacy, and I charge you $160 in claims. Now, if I charged you $160 in claims and we had a mandated 80% loss ratio, that means you had a $200 premium and you had $40 to operate your business. So the question that I have for you is, under that scenario, would you like to negotiate a lower contract with me as the provider, the doctor or the hospital, the same contract with me, or a higher contract with me? Which one would you choose? Correct. Most people would pick a lower contract because they're used to operating in a free market system. But let's take a look at that and see if that's really what you want to choose. See, if I charged you $80 in claims and you had a hard mandated loss ratio, that means you'd only have $20 to operate your business. Now, what if I charged you the original $160 in claims? That gave you $40 to operate your business. But what if I charged you $320 for claims? That would lead to a $400 health insurance premium because the government's going to give you what you have to have. But with $320 in claims, that would actually give you $80 to operate your business. See, we've built a business model that actually punishes the health insurance companies for trying to reduce medical expenses. Because the lower they reduce the medical expenses, the less money they have to actually operate their business. We're going to punish them. And under that scenario, eventually what happens is the insurance company is going to look at me and say, Craig, $320, that's all you can charge us in claims? Can't you get the contract higher? Can't we charge more money? See, I don't have to guess how this is going to work out because like everything that we talk about, I look for examples that already exist. See, when we look at states that have very strict medical loss ratios, what we find is those states have the highest premiums in the country, not the lowest premium in the country. Because again, we punish the insurance company for reducing medical expenses. Not to mention we have a whole nother factor going on. See, we have no idea what our claims will be next year, right? You could guess how much you'll spend in medical expenses next year, but you don't know for sure. So let's say the insurance company guesses that they're going to have $160 in claims and that they have $40 to operate their business and they charge a $200 premium. Now, the state's going to allow them to do that. They charge the $200 premium. They get to the end of the year and they only had $80 in claims. Now, in your world, you'd say, woohoo, I made some money. But that's not the way the government built this. The way the government built it is, they go, oh, you only had $80 in claims. That means for the year that already happened, that you spent $40 operating your business, you really only had $20 to operate your business, and you have to mail $100 back to your insureds. See, this whole Obamacare system is built to put the insurance companies out of business. Nobody can operate a business when they don't know what their revenue will be, and nobody can operate a business when you're punishing the one person that can reduce medical expenses for reducing medical expenses. I want you to know the truth and why it matters. And in our next session together, I'm going to show you why no insurance company in their right mind would ever investigate fraud. Thank you.